If you're considering trying a Reiki treatment, or maybe you've already had a treatment recently, it's completely reasonable to ask, is Reiki harmful? I think that that's actually a really intelligent question to ask, in fact. Whenever you're dealing with anything that affects your body or your mind, especially something described as energy, you definitely should pause and ask whether it's safe. And online, you're going to find two very loud extremes on this topic. Some people insist that Reiki is completely harmless and safe for absolutely everyone in all instances, no questions asked. Others claim it's dangerous, destabilising, spiritually risky, or even manipulative. Actually, the truth is a lot more grounded than either of those positions would suggest. When people ask whether Reiki is harmful, they're usually worried about one of three things. They're concerned about physical danger, obviously. They're concerned about psychological or emotional destabilization, or they're concerned about indirect harm, such as someone delaying proper medical treatment because they think Reiki will fix everything. So let's deal with those calmly and directly. From a physical standpoint, Reiki is about as low risk as it gets. There's no physical manipulation. There are no substances involved. There's no forced breathing, no electrical output, no mechanical intervention. It's either light touch or no touch at all. And for that reason, all the major health bodies have consistently described Reiki as low risk when used alongside conventional care protocols. And it's even used in hospital settings as supportive treatment. There is no evidence that Reiki interferes with pacemakers or medical devices because Reiki does not generate electricity or electromagnetic currents. Mechanically speaking, it's very simple. So in terms of direct physical harm, the risk is extremely low. Now, that doesn't mean nothing ever happens. Any inward-facing practice can produce reactions. That brings us to the psychological side of the question. Now, most people experience Reiki as calming or neutral. Some people feel deeply relaxed. Occasionally, someone might feel emotional, tired, or quite reflective afterwards. That isn't unique to Reiki. The same thing happens in meditation therapy, breath work, or even after a deep massage. When the nervous system slows down or when awareness increases, emotions can surface. That's not harm, that's the system processing. Now, where caution is needed is with people who are already in acute psychological crisis or severe instability. Reiki is not a substitute for psychiatric care. It is not a replacement for medication. It is not an emergency intervention. In someone with active psychosis, severe depression, or crisis, clinical support comes first. That isn't a weakness of Reiki. It's simply responsible practice. In the rare instances where people report feeling worse after a Reiki treatment, there are usually multiple contributing factors. It may be their expectations, suggestion, or maybe prior instability, or a misunderstanding about what's going to happen during the process. It's not common for Reiki itself as a gentle supportive practice to cause serious psychological harm in stable individuals. The more significant risks don't actually come from the energy or the technique, they come from misuse. Reiki becomes problematic when it is framed as something that it's not. If a practitioner advises someone to stop their medication, that's a problem. If someone claims that Reiki cures cancer, for instance, that's also a problem. If it's presented as some sort of miracle solution instead of supportive care, that is definitely a problem. Those are behavioral and ethical issues. They are not inherent properties of the practice itself. Another area where fear tends to gather is around attunements. I've heard concerns that attunements override free will, implant something into the system, permanently alter the nervous system or open a person up to something invasive. In practical terms, an attunement is a structured orientation process within a training environment. Nothing is implanted, nothing is forced, nothing mechanical is switched on. Most people experience it as stable. Some feel calm, some feel reflective. Occasionally, someone feels tired for a day or two. That is the extent of it. That is the vast majority of cases of people who experience an attunement process. When difficulties arise after an attunement, they usually relate to poor teaching, exaggerated language, fear-based framing, or unrealistic expectations. If someone is told dramatic stories about energy upheaval or mass detoxification, they may interpret normal emotional processing as something really quite alarming. Again, that's context and suggestion, not the inherent mechanism. It's not about the Reiki energy or the technique itself. So, is Reiki harmful? For most people, when used appropriately, absolutely not. Direct physical harm is extremely unlikely. Serious psychological harm is rare. Mild short-term reactions are possible, as they are with many or probably all contemplative or supportive practices. The greatest risks come from misuse, inflated claims, or replacing proper medical care with something that was never designed to do that job. Reiki becomes controversial when it's surrounded by exaggeration, mythology, or ego. When it's practiced quietly and responsibly, it is a simple, low-risk, supported modality. If you approach it with discernment, keep medical boundaries clear, and work with someone grounded and ethical, there is very little to fear.